and this is from PBS, the FDA will no longer recommend annual COVID vaccinations for healthy people younger than the age of 65. That means children too. Adults over the age of 65 and anyone over 6 months with one or more chronic or underlying health conditions like asthma, cancer, diabetes, pregnancy are going to be recommended to get a shot. To gain approval, pharmaceutical companies will need to conduct new randomized clinical trials for younger healthy populations, according to the FDA commissioner. This guy is an anti-vaxxer. His name is Martin Makary. He's a snake oil salesman. The shift was a marked departure from a previous guidance, which recommended annual COVID vaccines for everyone 6 months and older. They're basically saying at least 100 people will not be able to get, we have 360 some million people in this country. Right. Under this, they're saying about 100 to 200 will be eligible. So that means 100 to 200 will not be, right? What is our definition of a healthy younger person? Because there is so much literature that we know from exhaustive research from the last 5 years that says anyone can become unhealthy once they contract COVID because of the damage that it does to our vascular system and our organ systems. This is not up for debate. So the fact remains that me as a healthy person, I would benefit from the shot if it could help prevent severe disease, hospitalization, or death. They're also now finding that the more of these boosters that you've had or vaccines that you've had, your chances of getting long COVID are decreasing. Okay. Mm-hmm. So none of this stuff is foolproof, of course, but there is no harm in allowing people to get this vaccine. So why are we restricting people from getting this vaccine? We are not mandating it, but what now they're going to be doing is mandating that I and you or whomever they deem as healthy, whatever that means, cannot get it. To me, this feels like eugenics, because what I think they're trying to do here is if you get COVID and you become disabled, they don't want to have to pay for you. They don't want to have to deal with your Medicaid. All of this happening at the same time is by design. They are culling the herd. They want the weak, the unproductive, the disabled to die. That is what they want. They don't want them on the payroll. I don't mean to sound so callous about it, but I'm so frustrated. After 5 years, I've been COVID conscious. I mask wherever I go. I care about people. I've had countless people on my radio show, doctors, scientists. I had a scientist who worked on the original bats in the laboratory that started the original vaccine for COVID. She worked on that. Like, these are not paid spokespersons that are out to like get you this jab so you become sick from this COVID vaccine and they can, like the government can track you. It's like, we have phones for that, guys. It's like this vaccine saved millions and millions of lives. And as a person who has always believed in science and has always trusted the scientific method, I am all for us working on better vaccines, a sterilizing vaccine, which they've actually been working on. They're trialing it right now in mice. They did a nasal vaccine on mice and it's been working. But all of that is now at a standstill because they've cut the NIH grants. They've cut the money. So we're going to lose all of the advancements that we're trying to push us forward. And I guess I just keep going back to this idea that this falls back in line with this neo-Nazi white Christian fundamentalist, bullshit of trying to conform this country into looking like we're healthy, into looking like we're homogenous, into looking like one thing, when that has never been the case. Disabled people have always existed. Okay. Healthy people have always existed, but health is not a continual space. It's a place you are for a time in your life. And sometimes you're not healthy. So what does that mean? What are they setting us up for here? Like I am at such a loss, and I feel so angry. And I know so many people with long COVID. I lost my uncle to COVID just a few months ago. Like this disease is very much present with us. And I think this country sucks at collective grief. And we are in a state of denial, and we have been. We just want things to go back to normal, which they never will be again. And we don't want to look in the mirror and work towards a better future. And to me, this is the complete result of that. A lot of people, Desmond, are going to be directly hurt by this and all the cuts to Medicaid, Medicare. All of this, to me, goes together like hand in hand.
Doesn't make any sense to me why you would deny someone the ability to get a shot that they want.
Mm-mm.
We allow just about anybody to get a flu shot that they want, that who
That's
wants
right.
one. Anyone who wants one. You want one, you have one. If the vaccine was dangerous for quote unquote healthy people, and that
Mm-hmm.
was your reasoning for not allowing these healthy people to take the vaccine, where is the information and the evidence proving that it has become unsafe?
Thank
Isn't
you.
that normally the modus operandi here? Like you provide information saying this is why you can't have this. This is why we are restricting it. It's usually that simple. Here's the
Yeah.
evidence. Here it is. Now this is the reason why we have brought down this decision. But yet we don't have that. Just a
Mm-mm.
decision that's based on what feels like a culture war narrative, which
Yeah.
is people were upset about the existence of these vaccines. Funny enough, Trump is not one of those people, as he went around constantly talking about how big of a breakthrough this was because it happened under his administration.
That's right.
He loved bragging about Project Warp Speed and how he was
That's right.
vaccinated, right?
Yep.
So like it's funny how that all kind of went silent once he realized how unpopular it was amongst his base. But the one time I think I've seen Trump get bucked by his base, maybe the only time, truthfully
Yeah.
speaking. Um, so that is the thing that keeps popping up for me about this one in particular when you brought this story to my attention. It's like, if there was proof that there was something dangerous about this, why didn't you present it? And if you have
Yeah.
nothing to present, how do you have the ability to sit here and tell people that they cannot have it? How? It does not make any sense. I mean, if there is
No.
a medicine available and people want to take it and you have no good reason to withhold it from them, then why are you withholding it from them? And the
That's
only
right.
conclusion I can come to is that this is a culture war decision based upon an ability to have a talking point out in the political hemisphere for everyone so that you can go back and say, look what we did. We did this thing. Aren't you so happy about that? And so it's not rooted in science. Again,
No.
I keep using this phrase a lot the last like few days when we've been having these conversations, but these people are just unserious, Natalie.
I know.
I mean, at the end of the day, it's not that hard to provide proof of your accusation. And if you don't have it, don't make the accusation. Just keep it
That's
that
right.
simple.
Yeah, and I agree with everything you said. And I just wish we would get back to a place where we would trust people who have dedicated their whole lives to something. And I think the thing that bothered me about this too was science is a practice, right? And you learn things and then you change, and then you learn things and then you adapt, and then you learn things and you do them or you don't moving forward. So this idea that they're trying to suggest like you can't trust science because it changes, that's what it's supposed to do, right? I remember working in a
That is what it's
lab,
supposed to do.
and I was working on, we were working on cell cycles, and I was using these little like jelly things, and you see the DNA, it'll move through the jelly thing, and we were trying to figure out a sequence. And I must have ran this experiment, I'm not kidding, in the semester maybe 600 times. And Dr. Schwaka, I remember him saying to me, well, we know 600 ways it didn't work. And it was just like, it was, anytime I fail at something, I always
Yeah.
think of him saying that. And I say that to myself, well, I just learned another way it didn't work. And that's what
Yeah.
science is. That's what this method is about. It's trial and error, seeing what works, building and building and building and building. So the fact that we were able to fast track a vaccine that saved millions of people's lives should have been celebrated and built upon, because it's not a perfect vaccine and we could improve upon it. And it should be improved upon until we get to the point where it sterilizes this and neutralizes this disease. And so fewer and fewer and fewer people can contract it and therefore not spread it, right? But instead, we've allowed the worst virus of all, which is misinformation, to spread like wildfire. And it breaks my heart because when you see parents go on television who have just lost their child to measles, who did not vaccinate their child to measles, and say on camera, and I wouldn't vaccinate them again, they're in a better place, because of how deep this has rooted in their being, in their psyche. We have a problem, America. This is a problem. And nobody wants to see the iron lung come back. No one wants to see children go blind from the measles. These are all very preventable things. You know, we want our children to be able to enjoy their lives and run free. They can't do that if they have long COVID when they're 7 years old. And all of this is preventable. And it breaks my heart. So I appreciate the space to talk about it, not just from a journalistic perspective or a science perspective, but really just from like the human spirit, the condition of being human. Like, we need to do better for each other. I care about you and I want you to care about me. And that's the only way we get through this world. If not, we're forced to look at where we're at, which is all one, every man and woman and child for themselves. I don't want to live in a society like that. And that's not a functioning, healthy society.
You always have space to talk about the things that are important to you here, Natalie. Just, I think in the future, we will do so from a more well-lit environment. You're going to get Natalie a new ring
Guys,
light?
I need a new light. Desmond, okay. Are you telling me I don't look good? Just be honest. Damn it.
You were in a dark place, Natalie. We're going to fix it, though. We're going to fix it.
I've been trying to click it the whole time we've been here, but
it's over. It's over.
It's over, guys. It's over. So that'll be on my list of things to do tomorrow.
We had a few different issues today, trying to do this show 3 different times, but I think that, one way or another, we were going to get this done. I'm glad that we did, because these were 5 important topics that we had to cover today. And I also want to mention that for those who were not here earlier in the week, we actually did 4 topics a few days ago. We covered Trump considering a reality TV show for immigrants to win their citizenship.
Oh, man.
Fun times. We talked about the Department of Justice charging Congresswoman LaMonica McIver for assault of an ICE agent. So definitely had some important things to say there. We both did. The Senate passing No Tax on Tips Act. There's more to that than you might imagine there being. And then also, I think the last thing we talked about was a Black woman in Georgia who is now pronounced brain dead, being forced to carry a child to term because of the abortion ban in the state of Georgia. So all those topics were on our previous video. If you're watching this on Substack right now, both of us have posts from that conversation. You'll be able to see that on our particular newsletters. If you're watching this on the playback on YouTube or Spotify, those videos will be the previous videos on my channel. So you can go check those out there as well. Natalie, thank you so much. And I am hoping to see you again next week.
More clearly.
At least once. But, I'm going to talk her into twice. We will kind of see how the week turns out. There's so many things to talk about.
Oh, my God.
There's no shortage of topics. I mean, Natalie, when I was thinking about what we're going to talk about today, I had a list of like 15 things.
I know.
It's just there is not enough time to talk about them all, and I always feel guilty about that. I really do. I feel like I'm leaving things on the table that are important, that people should hear about, and it's hard to be like, what are we going to focus on today? Because there's just only so many things you can talk about. We can't sit up here for 4 hours. I mean, I'm not Hassan Piker. I cannot do what he does. I'm not sure if you know who he is. But he is a political streamer on Twitch and on YouTube. This man streams for 8 to 10 hours a day, like 5 days a week. I don't have that stamina. I do not. Maybe I need to get on a bike.
But that's insane.
It's a lot.
He's going to burn out. It is a marathon, not a sprint.
But yeah. Anyway.
No, this
Natalie.
was great. I appreciate everybody that tuned in to watch us live. The conversations that we're having are really important because, the world it can be a very daunting place to be in right now, but being in community is the
Yeah.
anecdote. And this is a community. So we appreciate you guys tuning in and being a part of this, and for following our work. And we appreciate all the questions and the comments. And I look forward to being with Desmond again in the very near future, hopefully next week. And we'll be back with more to share. So if you haven't
Yes.
given us a follow or subscribed, please check us out. And I'm also on Instagram at Natalie Bencivenga and on TikTok. And Desmond, where can people find you?
Instagram, TikTok, here on Substack, here on YouTube, depending on where you're watching this at right now. If you're watching this on YouTube, please go ahead and give this video a like. If you're on Substack right now, you can click on the top of the screen and you can subscribe to both of our newsletters. We will see you next week.
Sounds good. Hopefully with better lighting.
Yeah.
I got the memo.
I will
Thanks.
send you a good link. Okay.
Bye, you guys.